This little light of mine, I'm gonna let it shine. This little light of mine, I'm gonna let it shine. This little light.
The Institute of Medicine estimates that at least 18,000 Americans a year die because they have no insurance.
I think it's too expensive. I think other countries have a lot better health.
They literally have laid off people solely for the reason of the health insurance.
Figuring out various ways to increase the deductible or a tax credit, it has nothing to do with lowering the cost of health care.
These layoffs with small business, one of the things that we do is we sit down with the small employers and look at their health care costs. We do a health risk assessment on their employees to help them determine what their issues are, and then we try to provide programs for them to help them keep their employees healthier and then help them keep their costs down.
Because you don't qualify for low income, but you don't have enough money to pay for this treatment, that treatment. I mean, that the treatments are up.
Less than 2% of all of our medical school classes are going into primary care.
What do I think of healthcare in America? I think it sucks.
All the money that's spent in healthcare right now is enough to meet every basic healthcare need.
Because they cannot afford to pay all the funds up front to pay for themselves. That's a major issue.
It's a disgrace.
A third of all of our primary care physicians are 55 years of age and older.
That the kind of system we have is actually rationing our health care, is actually rationing who lives and dies, is actually rationing who has to go through financial ruin instead of getting the kind of care that they need to get. That this is a consequence of a for-profit healthcare system.
It's a matter of where do I appropriate the money? It's not coming, through the door.
It's not the America that can be. An America where everyone is covered. An America where everyone has a card.
For the employee who, say, for example, has a pre-existing condition and they have not yet saved that deductible, that becomes an issue for them in terms of they may have to scale back on their care.
If you had paid for what the health insurance was costing, could you have afforded to keep paying your mortgage?
No, I couldn't. I could not.
A child born today in America that does not smoke and is reasonably well informed about nutrition is going to live to be 100 years old.
I can't afford it.
47 million Americans are uninsured. By itself, that's a staggering number.
We are all advocates for our industry, but there are no patient advocates here.
And a single payer system would not have anywhere near that amount of rationing.